Hello friends, now I will be talking to you about G6PD deficiency. This is the most common enzyme defect in the RBCs, and as far as inheritance is concerned, this is X-linked recessive disorder. So as it is a X-linked recessive disorder, the females will be carrier and it will be the males who will be suffering from the disease. Now let's see what the pathophysiology. As far as pathophysiology is concerned, now this enzyme G6PD, glucose 6-phosphate dehydrogenase, this enzyme is involved in the pentose phosphate pathway. Okay, and if this enzyme is deficient, that lead to reduced formation of glutathione reductase, and this is normally is responsible for taking care of the oxidative stress in the RBCs. As this compound is reduced, so that lead to increase oxidative stress. So RBCs are not able to sustain the oxidative stress, and they are susceptible to hemolysis due to this stress. Now what are the causes which lead to increased oxidative stress? Infections. This is the most common cause of oxidative stress, any bacterial or viral infection. Certain drugs like sulfa, anti-malaria like chloroquine, primaquine, then dapsone, then fava beans, and any cause of metabolic acidosis like diabetes, ketoacidosis. So all can precipitate hemolysis due to G6PD deficiency. Now let's see what the clinical features. Typically in these African American or Mediterranean males are involved. I told you it's a X-linked recessive disorders. So in this patient, there is extravascular hemolysis, but sometimes it may be even intravascular hemolysis can occur. Now what happens is, due to extravascular hemolysis, there will be anemia. In fact, anemia will happen due to both, but there will be episodic jaundice. And due to intravascular hemolysis, there will be hemoglobin urea. There will be hemoglobin urea, that is dark color of urine. Dark color of urine is classically a feature of hemoglobin urea. Now what happens when you have to diagnose? The best initial test is peripheral blood film. This is the best initial test. Now what you get in the peripheral smear, when you stain with supravital stain like methylene blue, you can see Heinz body. Now what are these Heinz body? They are denatured globin, which are precipitated in the RBCs. And when the RBC containing Heinz body, when they go to spleen, macrophages, they tend to remove the cells. That's why hemolysis occurs extravascular. At time, macrophages, they tend to remove the Heinz body. So what you get, suppose this is the RBCs. So they remove a part of RBC membrane, and that is known as bite cell. So bite cell is nothing but a RBC whose a part of membrane has been removed by the macrophages. So these two are classically seen in a case of G6PD deficiency. Now, so when patient come to us with a history of taking a drug or some infection followed by jaundice or hemolysis and dark urine, then you always think about G6PD deficiency, of course, in the case of males. Now, what are the most accurate tests is to check the G6PD level. But remember, this should be never done soon after hemolysis. It should be done after 2 to 3 months of hemolysis, because young cells, they tend to have normal G6PD, but as the cells they become mature, the G6PD level goes down. So that's why this checking should be always done after 2 to 3 months. As far as sometime it may have massive hemolysis can occur. In that case, even acute renal failure can occur, but it's uncommon. As far as treatment is concerned, in the treatment, the best treatment is always avoid the offending agent. Is the best treatment anything, drug? Okay. These patients should be given continuously, folic acid should be given if there is hemolysis is going on or has occurred soon. Okay. But if massive hemolysis has occurred, then even you may have to go for blood transfusion. But by and large, they are uncommonly required. This is all about G6PD deficiency. Thank you very much.